Hello everyone, welcome back to my channel. My name is Next Stage. If you're new here, please do all to subscribe and be part of this amazing family. So guys, in today's video I'll be doing a breakdown of how the nursing program is studied in a Nigerian university from 100 level to 500 level. So no, like I said in my video that I talk about things I never knew before I entered the nursing school. Each school has its peculiar way of doing things, but what I'm going to say now is what is common to most schools, especially in Nigerian universities. Okay, so let's get right into the video. So when you gain admission to study nursing in a Nigerian university, at 100 level you study basic courses like biology, chemistry, physics, maths, use of English. Then you study other general studies courses like philosophy, use of library science, computer science, logic. Yeah, so that's basic what you do in 100 level. Then in 200 level you start doing basic medical courses. You studying, sorry if I'm looking down because I have my right up here. So in 200 level we start doing basic medical courses like anatomy, biochemistry, physiology, and then they start introducing other nursing courses like foundation of nursing, psychology in nursing. So in anatomy, this is the thing here, different schools have the way they want their nursing students study anatomy. There are some schools that just make their nursing students based on just systemic anatomy, but there are other schools like my school, they do gross anatomy. They make nursing students do gross anatomy, histology, embryology, basically the main, like the basic parts of anatomy, which is like gross anatomy, histology and embryology. They make nursing students do it in my school. Yeah, so yeah, in 200 level we also be introduced to basic nursing courses like foundations of nursing, where they teach you about the basics of nursing, history of nursing and other things. Then also psychology in nursing too. Also in 200 level you start being introduced to clinical areas. At 200 level you start going to the hospital, start seeing things, to start like those, you will be introduced to the practical aspect of nursing from 200 level. In 300 level you start doing major nursing courses like medical surgical nursing, mental health nursing, maternal and child health nursing, and then you still do like other mandatory courses like microbiology and pathology in 300 level. And then 300 level 2, your clinical experience become intensified in 300 level. Very important to note that at the end of your 300 level you are not supposed to have any outstanding course, whether be it core courses or mandatory courses. This is because this is a pre-professional class, and then you're meant to clear all your courses. You're not meant to have any outstanding course. You're not meant to have any course you did not sit for, any carryover at the end of 300 level. If you do have any outstanding course or carryover that you've not written, again it depends on the school you attend. Some schools organize summer classes where students can, like, they brush up students, and then students are given the opportunity to rewrite the courses they failed or the courses they were not able to register for during the summer classes before they get to 400 level. While some other schools will just tell the students to repeat the previous class, which is 300 level. They'll just tell the students to repeat 300 level. Then for 400 level is a professional class. It's the class you write your first professional exam. That's if your school is offering more than one professional exam. you write your first professional exam, which is the registered nursing professional exam organized by the Nursing and Midwifery Council of Nigeria. So in 400 level, like, you're doing just plain nursing courses, like plain nursing courses. And before I forget, at the end of your 300 level, you're also supposed to go for your psychiatric and orthopedic posting. This is before you enter the professional class, which is the 400 level class. So in 400 level, you do major nursing courses like still mental health, med-surg. Like, this time they are just teaching you just nursing courses. You no longer have any mandatory course. In 500 level is, that's if your school is studying nursing for 5 years. Like I said in my last video when I talked about things I wish I knew before entering nursing school, I said some schools offer 4 years to study nursing, while others offer 5 years to study nursing. So if your school offers 5 years to study nursing, the 5th year, which is your 500 level, is a specialty nursing class. So in this class, even though you still do other nursing courses like medical surgical nursing, there is also room for you to specialize in other aspects of nursing, like palliative nursing, geriatric nursing, pediatric nursing, and the rest of them, depending on what your school has to offer. Also, is in this 500 you write order of your professional exams if your school is offering that, like your registered midwifery exam and your registered public health nurse exams. Yeah, that's just a rundown of how nursing is studied from 100 level to 500 level. Then for the postings, I'll also give a rundown of postings, of the postings involved in nursing and when it's expected to occur. So 200 level, note that 200 level, I mentioned that your clinical experience starts from 200 level. So in 200 level, they're basically introducing you to the clinical area, so you may not really do any special thing. They may just send you to like different wards, not even cleaning, they may just send you to different wards to do like the basics of nursing, which is like vital signs, and then for you to know how to interact with your patients. Then the major posting starts from 300 level when you do your medical surgical nursing posting. Then you'll be posted to medical wards, surgical wards, like female medical ward, male medical ward, female surgical ward, and male surgical ward. Also, is in 300 level you do your ENT posting, which is like special senses posting. ENT is ear, nose, throat, and eye posting. You're supposed to do that posting too in 300 level. Then at the end of 300 level, like I mentioned, nursing students don't have holiday. So basically the holiday between your 300 level and your 400 level, that long vacation you're supposed to have, you end up using it for your psychiatric and orthopedic posting, which is meant to last for 7 to 8 weeks depending on what your school is offering. And then after that, then it will be your 400 level when you write your registered nursing professional exam. And then if your school is offering further education, then you do your O&G posting, which is obstetric and gynecology posting. You do your midwifery posting and community posting. These postings will be done between your 400 level and 500 level. Then let me just talk about the exams, professional exams in nursing, just the basic structure of the professional exams in nursing. So for the Nursing and Midwifery Council of Nigeria, which offers registered nursing and registered midwifery exams, they have 3 papers: paper 1, paper 2, and OSCE. So paper 1 comprises of 100 OBGA, and then 3 essay to attempt all, and this is like peculiar to all nursing schools. If they tell you attempt all, my sister, my dear, write something. Even if you don't know what to write, just like write the number, any number. If let's say it's number 3, you don't know what to write, just write number 3. Even if you want to copy the question back for them, just make sure you write it on your answer sheet, because if you don't, you automatically fail that paper. So there's an instruction to attempt all questions. And then paper 2 too, you have 100 OBJs and 3 theories to attempt. Or maybe as I'm saying, these 3 theories is like, it's not 3 theories, my dear. Those 3 theories will have children and grandchildren. And then for the last paper, which is the OSCE is divided into 2. We have practical and we have vival. So the practical will be like, they'll set stations for you, and then you're supposed to come out, perform some procedures at the different stations. This practical also has the question station. So there is a procedure station and a question station, a procedure station and a question station. And then the OSCE also comprised of the viva. Basically, viva, they'll ask you about your projects, how you came up with your result, and all those things. And then a few times they bring other things too, like instruments. Sometimes they ask about anatomy, sometimes they ask about physiology. So it depends. Yeah, so that's the structure of both registered nursing exam, registered nursing council exam, and registered midwife council exam. I want to know, please let me know in the comment section if this video has been useful to you in any way, and please give this video a thumbs up, subscribe to the channel if you've not, turn on the post notification bell so that you'll be notified each time I post any video. And also, if you have any question concerning nursing school, please do well to leave it in the comment section, or you can follow me on Instagram and send me a DM. My Instagram is IAM_Tage, TAGE. Thank you so much for watching this video, and I'll see you in my next video. Bye.